The Opioid Crisis. The epidemic is the subject on everyone's lips and in local and national news reports every week. Pinellas County is not immune, and our faith-based community leaders are well aware of that fact. The Focus Community Connection Symposium held at Anona United Methodist Church highlighted the challenges our communities currently face in the wake of this ever-growing tragedy. Entitled The Opioid Crisis in the Faith Community, social service workers, faith-based community leaders, and several authorities came together to put a spotlight on how to better serve and educate local congregations about the resources available as our country struggles to combat this national emergency. It was a full day of enlightenment, starting with a welcome from New Path Community Church Senior Pastor Bill Lasasso.
At Focus, we're a group of individuals who come together to plan and to put on symposiums. And we choose subjects that are very relevant to the world around us. The idea, by the way, to bring the faith community and the secular social service world together to better serve all of our people, was the brainchild of one of the greatest leaders in the battle to help children and families in the history of Pinellas County. She's currently the Chief Executive Officer of the powerful Juvenile Welfare Board and is the co-chair of Focus. Let's welcome Dr. Marcy Biddleman.
Thank you very much. I'd like to just welcome everybody this morning. We're always pleased to be part of this and to help to bring the faith community and together with all of us who work in the field of social services, of helping children and families, of just providing everything that we can. There's no doubt in my mind, and I've always said this, that the first social workers were in the church who hand out not only good advice, but they know where that people can get help.
We thank you, dear Heavenly Father, that we, your children...
The warm welcome was followed by prayer and songs of praise to start the day. Then keynote speaker Gail Guidish, the facilitator of the Pinellas County Opioid Police Task Force, took the stage to give an informative and enlightening presentation. Ms. Guidish went on to describe how opioids work in the body, as well as provided an in-depth explanation about these drugs and how devastating they have been to Pinellas County. What do opioids do? Opioids are the synthetic forms of opium from the poppy seed. They block pain receptors in the body. They are very good at relieving discomfort from surgery or injury. Why are opioids so highly addictive? Opioids are so addictive because in addition to blocking pain, they also give a sense of euphoria and pleasure. Before this crisis occurred, doctors said there was no problem with taking opioids. The early philosophy was to give patients as much as they needed to stop the pain. And we as the public listened because it was coming from the medical community. But whether prescribed by a licensed physician or even given to you by a well-meaning friend, using opioids can lead to addiction very quickly. What are some opioids I may have been prescribed? Most likely you have been prescribed these types of medications such as fentanyl, oxycodone, and hydrocodone for post-surgery and injury pain. How can taking too many of these drugs affect the body? The danger of taking too many of these drugs is due to their depressive qualities. They slow breathing and heart rate. Why are so many people dying? Due to synthetic versions of opium, like fentanyl and oxycodone, the strength of opioids is very different today than it was in prior decades. It takes a smaller amount to feel the pain relief as well as the high than it used to. Another risk factor is people may also be mixing these drugs with alcohol, as well as buying other illicit drugs on the streets that are not controlled or regulated. In addition, people are ashamed of their addiction and they want to keep it hidden, so they will most likely use these drugs while alone. Consequently, if they begin to overdose and their breathing slows and they become incapacitated, there's no one around to call 911. What are the signs of an overdose? Depressive factors begin to happen in the body. Look for blue, ashen, or grayish skin, blue, ashen, or grayish lips, slowed or stopped breathing. They may also not be able to speak. Is there a specific demographic of people who are struggling with this addiction? No, there is not. It's happening in all walks of life, in all locations within Pinellas County, in churches, mosques, and synagogues, all houses of worship. When you look at the statistics, it's not just teenagers or young adults, it's everyone. Everyone is at risk. It's everywhere in Pinellas County, which results in many overdose emergency calls. In 2016, 2,500 calls were made just on opioid overdoses. What will it take to stop this problem? We must end the stigma, especially in churches. If someone comes to you and says they have a problem, we have to be willing to open our hearts to them. In Pinellas County, there is an opioid task force. They are there to raise awareness and connect those in need of treatment to those resources. There are medications that reverse an opioid overdose in the moment that can be given, as well as health treatments and family recovery resources. If you are having pain and have had issues with addictive chemicals, discuss alternative pain relievers with your doctor. Don't go directly to opioids when over-the-counter options may do just as well. Check your medicine cabinets and dispose of any expired or unused medications. Here are some tips on how to dispose of old medications properly. Do not flush any medications down the toilet or throw away in the garbage. Remove medicines from bottles and place in plastic baggies. Liquids should remain within their original container and the cap secured with tape. Drop off your expired or unused meds during business hours at Pinellas County Sheriff's Operation Medicine Cabinet boxes located throughout Pinellas County. Operation Medicine Cabinet will accept any prescription drug or medicine used for people or pets, including pills, liquids, inhalers, patches, and EpiPens. Following Ms. Gaidesh's impassioned and informative presentation, there was a panel discussion featuring some of the most prominent law enforcement, health and children's advocates, religious leaders in the community, as well as testimonials from a former user about his struggle with opioids and finding healing in his faith. The faith-based community and social service providers working in concert are fighting hard to solve this national epidemic right here in Pinellas County. It will take this kind of effort on all fronts to make a dent in its effect on our families. The Juvenile Welfare Board is very grateful to have the support of its partners and community as we strive to combat this problem. If you or someone you know is struggling with opioid addiction, call the 24-hour helpline at 888-727-6398.